from Delta or other strains or variants of COVID. We're not sure yet. So what we're seeing on the ground in South Africa is that there is anecdotal evidence that among young people, there are mild symptoms. But, we saw this before with Delta. Younger kids, college kids, fare very fine with COVID-19. And so this isn't necessarily a representative sample of what may happen, what may come down the road with Omicron. There's a few cases that were found in Hong Kong after traveling from South Africa. Those were asymptomatic cases, and so that's good news as well. So we don't know. We know that hospitalizations are starting to increase in South Africa. We know that cases are starting to increase in South Africa. And so we're kind of at the mercy of time to see how well our bodies bode with Omicron. It's important to recognize that once someone is infected or once cases start to rise on a population level, like we're seeing, South Africa cases increase, it's important to recognize that hospitalizations and deaths lag about 2 to 4 weeks after cases rise. We've seen this consistent trend throughout the pandemic. And so we're kind of, unfortunately, waiting to see really what happens. And we'll see if Omicron is more severe or not compared to Delta or Beta or Mu, for example. Should people be avoiding super spreader events given the uncertainty around this new variant? Yeah, it's a really good question. I know that the WHO, I think, just came out this morning saying those that are 60 years and over shouldn't be traveling. I think that it's important to recognize a lot of countries across the world don't have access to boosters like we do in the United States. I think right now, if you're fully vaccinated, and that includes having a booster for at least 2 weeks, and you're wearing a mask, you're pretty good right now from all we know. I think what we also need to do in the United States is, like I said, continue to wear masks inside, but 2, really leverage testing. We haven't used testing enough to our advantage in the United States, and this includes rapid antigen testing. And so you can go get a test at, for example, Walgreens. They're, $25, unfortunately a little more expensive for the average American, but you get 2 of them, and you can use these tests after you went for a business, flight. Once you come home, you can test and you'll get results in about 15 minutes. So we really need to leverage testing. So if you go to an event, it would be great if you could test before and after, and really try to be cognizant that, 1, we already have a lot of high transmission in the United States right now. And then 2, we may be adding fuel to the fire if and when Omicron comes and starts spreading in the United States. Are U.S. health departments able to analyze COVID-19 infection results from last few weeks to know if and to what extent the Omicron variant is already in a location? So we can do this with our genomic surveillance systems. U.S. health departments, some of them have very special labs, usually CDC contracted labs. We also have public health labs across the country. We have 68 of them. And we have a repository of those sequences that we've been keeping on top of. Like I said, we sequence thousands and thousands per week to try and identify. Nationally, about 5% of all specimens are sequenced each week. And so this means that our system in the United States can detect a variant down to about 0.01% of circulating variants. But this doesn't mean it'll catch 1 or 2, previous cases. And so like Belgium, that is doing post hoc retrospective analyses, we may be doing that in the United States. The problem is you're going to be trying to find a needle in a haystack. It's really a lot more helpful to know where our first case is detected and then start testing around where that case was detected. And so we're probably doing a little bit of retrospective as well as proactive right now. With new variants emerging as the virus mutates, do you see need for regular vaccinations and boosters moving forward, like yearly flu shots? This is a great question. We don't know the answer to this. I feel like I keep saying that. But, I think that we don't know. A, a booster like the one we're doing right now, and hopefully everyone's already gotten their booster, really helps with longevity of protection. And we're hoping for that longevity to show with Omicron because, like I said, our boosters really reset our factories, our antibody factories that can adapt to new threats. That said, we know that SARS-CoV-2 is mutating quickly. I think it's mutating every about 2 weeks across the world. And that's because of high transmission. And so once we get that transmission calmed down, this virus will not mutate as quickly. It will not mutate as quickly as the flu that we have to get a new vaccine every year. It will mutate, though, more quickly than, for example, measles that hasn't changed since the 60s. And so it's going to be somewhere in between. Like I said, it's hard to estimate what that cadence is going to be because of the rate of transmission and the rate that this virus is changing. But there's a lot of hope that we won't need a booster for a few more years, but I guess don't quote me on that. Next question. Could Omicron bring us back to square one of this pandemic? No, it cannot. And that is because our vaccines are incredible. Our immune systems are incredible. I hate when I see the word vaccine escape or immune escape language floating around because this is not the reality. Immune escape is not a binary yes/no event. We're not going to start from square one. What this is that the vaccines and immune systems are going to be or our vaccines effectiveness is going to be chipped away slowly but surely, and that's kind of what we're seeing. Immune escape is more like corrosion rather than starting from square one. And so no, I don't think we're going to go back to March 2020. I certainly don't think we're going to have lockdowns. We have things that work. We know masks work. I know a lot of people don't like wearing them, but masks reduce transmission by 58%. So it's not amazing, but it does something. And we have amazing rapid antigen tests right now as well. And we're on top of this virus. I can't emphasize enough how valuable it was for South Africa to identify this variant quickly, share the data incredibly quickly, and share in real time what's happening on the ground. So thousands of scientists are already on top of this, trying to decode the threat. So no, we're not going to start from square one. I can tell you that for certain. Is there anything you can tell us about the new variant in children as far as it causes more severe disease? This is a really good question. So in South Africa, we are seeing a high number of kiddos hospitalized for SARS-CoV-2. Then, for example, we're seeing in the United States right now with Delta. It's important to recognize, though, that the population, the genetics, the situation that's happening on the ground in South Africa is and can be very different than what we'll see here in the United States or across the world. Environment impacts disease, genetics impact disease. We have very small sample sizes right now in South Africa. And so while this is concerning news, I am still confident that kids will be relatively resilient, like we've seen throughout this pandemic with Omicron. And we know that their vaccines are on the way too. I have 2 kids under 2 as well, and so I'm really looking forward to the day that we can vaccinate them and protect them as well. But keep in mind, protecting them, you can still protect them right now. Doing antigen tests, wearing masks so you don't bring the virus home, even if you're vaccinated, getting that booster shot can do a lot to protect our kids in the United States right now. When do you think we can anticipate vaccines for our children's 6 months so 5 years they are eligible right now, so 6 months to 4 years. So, like I said, I'm paying attention to this really closely. I'm hopeful that we will get some sort of data this month, so the end of December. Once we see the data that it's safe for our kiddos and then also effective, then Pfizer will go through the process of submitting an EUA application, the scientific advisory board meeting. So, I think that 2 to 4-year-olds may be early 2022, January, February, maybe. It may be a little longer for 6-month-olds to, under 2. That may be in March or April, but it is coming. We know the data is coming in. We just have to look at this data because those kiddos are actually going to get a different dosage than 5 to 11-year-olds, than 12 to plus year olds. And so we really want to make sure that the vaccines will work with this new dosage, and of course that they continue to be safe. With all of this political unrest and pandemic fatigue, I'm exhausted. I am exhausted too. What kind of hope can you give us? As an epidemiologist, I can tell you right now that every epidemiological curve comes down. This one will come down too. This will end, I promise you. We need to get more people vaccinated. The quicker we have protection, the quicker we can get transmission down, the quicker we enter an endemic state. This is incredibly important, not just in the United States, but across the entire world. As you can see, what happens in South Africa, what happens in the UK, what happens in Colombia, what happens in the United States directly impacts all of us. And so we need to figure out this vaccine equity situation. We need to get more people vaccinated. And we need to stay on top of this virus so it doesn't continue to control our world. We will get out of it. It's just a matter of time. So I think that's all the questions we have, or all the time we have. Thank you so much for your great questions. I hope this was at least a little helpful. You can, I answer a lot of questions through my Substack email, yourlocalepidemiologist@gmail.com. I try and post something with these Omicron updates every couple days, and trying to really decode the science and what's going on the ground and what we can expect, what questions we have answered and not answered. And then we also have the U.S. Surgeon General coming on Path Forward here later this afternoon at 4 p.m. Eastern time. And I know he'll have some really great insight on what we do and do not know as well, in case you have any other questions. But thank you so much for having me, and good luck out there. Get vaccinated and be safe. Thank you.